Dr. Ignacio, I've got 147 on the board behind you, and then to help the jury understand what we're looking at here, if you need to reference any of the body diagrams, please just let us know which body diagram that we need to have up on the easel, and then we'll use that to coincide with what we have in the photographs up on the screen. Is that okay?
Okay.
So in People's 147, is that a picture from the scene underneath the bridge of the boy that was eventually identified as Gannon Stauch?
Yes.
And is that the same child that you performed the autopsy on March 18th?
Yes.
Okay. You could advance to 148. So we're looking at People's Exhibit 148 now on the screen. Let's just go preliminarily. Are there very apparent signs of decomposition visible in People's Exhibit 148?
Yes.
Can you just describe, so that the jury understands, what it is that you are calling that decomposition?
The whole body looks decomposed. It doesn't look like, normal fresh body. You see a brown gray discoloration on the skin. The right hand, you can already see the bones because it's starting to decompose the skin.
Dr. Ignacio, that red handle thing is a pointer. I see that you're pointing with your hand. That may help you, may not. It's up to you.
Okay.
And the tip of that thing pops off just to keep you on your toes, doctor.
So you can see that the right hand, you're already losing some skin there, so the bone's exposed. You're already seeing bone here because the skin's already decomposed and disappeared. Brown discoloration all over.
And then there's black linear lines in the abdomen and chest area, and also on the, I guess would be the left hip there. Are those also signs of decomposition, or what does that appear to be?
Yes, I think it looks like could be from the clothing.
Okay. So clothing can have an effect on a body as it's decomposing as well?
Yes.
Okay. So there's a measurement device there in People's Exhibit 148 as well.
Yes.
Is there a wound apparent in People's Exhibit 148 that you can point out for the jury?
Yes.
And if you need to stand up, you can feel free.
There's a laceration here on the left chest. Right, this one here. You can't really see it clearly because of the decomposition. The lines are ill-defined. There's a wound here, a wound here. Here. There's another wound up here.
And then as we go through these photos, is it a wide angle shot like this where you can see sort of contextually where a wound might be and then it zooms in closer in the next photo?
Yes.
All right. When you say a laceration, just so that we're all on the same page.
It's not a laceration, it's a sharp force injury.
Okay. So that's what I wanted to ask you about. A sharp force injury, what does that mean when a person like you, a medical examiner, says that?
It's a wound caused by a sharp object like a knife or a blade.
Okay. And can you tell us, generally speaking, we're going to look at a number of these sort of sharp force injuries. Are these deep injuries, shallow injuries, generally speaking?
It depends. Some could be shallow, superficial, or they can be deep.
And that's as apparent in this particular autopsy as well. Some are deeper than others.
Yes.
Okay. If we could go on to 149. Is 149 a close-up of what we just looked at in 148?
Yes, this is a close-up.
So can you tell us, as we look at that, how we understand that to be a sharp force injury? What about it tells us that?
Looking at the wound here, you can't really tell it clearly, but when it went into the rib, the third rib, you could see that it's a sharp, like clean-cut line because it hit the rib and the space between the two ribs, which is called the intercostal space where there's muscle. So that wound there looks like a knife wound or something that's sharp, caused by something sharp.
Did the decomposition state of this body cause some difficulty in identifying injuries that might have been contributing to what caused the death in this case?
Some of them.
Okay. If we can move on to 150.
This is another sharp force injury. And you can see that it doesn't really look like a sharp force injury because it's got jagged edges from the decomposition. But then you can see the wound inside, that it was just like a linear, straight, clean cut wound.
If we could go on to 151.
And that's a close up of the wound.
So let's talk, now that we're seeing this one close up. This looks almost like a hole in the body as opposed to a slit or a slice or maybe even a stab. Tell the jury why that might be for this particular injury and how you can still call this a sharp force injury.
Yes, if you look at the skin here where it was cut, it's clean, it's a straight line. But because of decomposition, there's stretching of the skin and it loses elasticity. So that's why it looks round and not slit-like. Like this one is another wound that looks like a sharp force injury. You can see that it's got sharp tips. That looks like a knife wound.
Okay. If we can move on to 152, I believe the numbering is.
So there's another sharp force injury in the chest, the left chest. So you can see that it's also elongated. That didn't enter the chest cavity, but just hit the muscle, the pectoralis muscle.
Okay, and then 153.
That's a close up. You can see that it's got a clean line there, straight edge.
Okay, and then these measuring devices that we see in these photographs, does that help us give an idea as to how long a particular wound might be?
Yes.
Okay. 154.
Showing the sharp force injury that's like right above the clavicle on the left.
One thing I want to have you point out in this particular photo, Dr. Ignacio, is there's a blurred area on this particular photo. Has that been altered?
Yes.
Does that just, if it had been unblurred, would show the victim's face?
Yes.
And is this just to be more sensitive to the victim and potentially the jurors as we're watching this or looking at these?
Yes.
155.
This just shows you a close-up view of the same one that was above the clavicle, left clavicle.
And this one again looks almost roundish. How can you tell and how can we understand this to be a sharp force injury as well?
The edges are clean and straight. It's not jagged. And the wound that was in the muscle was also straight.
Okay. 156.
This one shows you another sharp force injury in the left upper arm that's near the armpit, right there.
And 157.
And this is a close-up view.
So now that we've seen several of these sharp force injuries where they're almost pulled open and a rounded appearance, is that basically what you testified to earlier, that as the skin is shrinking and pulling away, that it pulls the wound open more than it would have if we were close in time to when these injuries occurred?
Yes.
Okay. 158.
Here's another sharp force injury on the left wrist region.
And this one we can now see must have been taken before the clothing was taken off the body. You can see some of the clothing that the victim was wearing. Is that likely what the person was wearing when they died?
Yes.
How can you tell that?
Because of all the fluids, decomposition fluids, the coloring, the clothing.
We had a crime scene technician from Santa Rosa testify late last week that also testified that there were defects in the clothing indicating that there were these slices or sharp object cuts into the fabric that coincided with the injuries we see on the body. Did you notice that as well?
Yes.
Okay. 159.
159 is a close-up view of the wound on the left upper arm, like near the axilla.
Okay. And all of these injuries that we're looking at, are all of those injuries marked on that body diagram that you have up on the easel there,
Yes.
which is 144?
Yes.
Okay. We could go to 161. Is that right? 160, my apologies. What are we looking at in 160?
So this is a photograph of the left hand, and it kind of covers, the ruler covers it, but there's another cut here. Sharp force injury.
And moving on to 161.
And this is the right hand, the back of the right hand. And you can see here that you've got 1, 2, 3, 4 wounds here. And you can see like the edges are clean cut, caused by a sharp object.
And we're looking at these in conjunction with the last photo of the arm and then this one here with hands. When we're talking about cuts to the hands and the forearm areas of Gannon Stauch, how would you characterize those types of wounds?
They're consistent with defensive wounds, trying to protect yourself.
Indicating that potentially Gannon was putting his hands up to guard against whatever was happening?
Yes.
And then they get cut in the process of that?
Yes.
Okay. 162, please.
This one shows, excuse me, this one shows the right hand, like the palmar aspect of the right hand. And this is another cut in the middle finger, right middle finger.
163.
It's the same photo right there.
Okay, and this is
This is
just,
the ring finger.
right.
This is the, that's the middle finger, and the ring finger's right here.
Okay. And then you're just pulling the fingertip back to be able to see that particular cut more towards the, I guess, the pad of the fingertip?
Yes.
164, please.
So we're looking at his back, and there's a sharp force injury on the left upper back, right there.
This sharp force injury to the upper back, was this one of the deeper sharp force injuries that you were able to document that Gannon suffered?
Yes, it fractured the left sixth rib, and it also penetrated the left fifth intercostal space. So that's the space between the fifth and sixth ribs.
Does that then cause, I guess, entry into, I guess, the back side of the chest cavity? Does it go that deep?
Yes, it does enter the chest cavity.
165.
And that's a close-up view of the back injury.
Again, is this a sharp force injury similar to the other sharp force injuries we've been looking at this morning?
Yes.
166.
So there's another sharp force injury here. Another one here.
Would this be essentially the backside of Gannon's left shoulder?
Yes. So this wound ended in the scapula. It hit the bone here, so it just went through the bone, the shoulder blade. And then this one went deeper into the shoulder joint, the left shoulder joint, about 4 inches deep.
4 inches deep, you said?
Yes.
167, please. This is a close-up of that more shallow injury, and then the other deeper one is apparent sort of to the left of that.
Yes.
There appears to be some black fiber there. Can you tell the jury what that is?
It could be from his jacket or t-shirt.
So basically fibers from clothing.
Yes.
Is it common for fibers from clothing to get caught up in wounds when there's these sharp force injuries that travel from outside of clothing through the clothing and into the body?
Yes.
168.
This is another view of the top of the shoulder where you can see the injury that went into the shoulder joint.
169.
That's a close-up view. And you know that it's a sharp force injury because it's got clean edges here.
So when you're pointing at those, what you call clean edges, to me, it doesn't necessarily look that way, but I'm not in your shoes with your expertise. Those edges that you're pointing at, is that where the skin would have met before being sliced open?
Yes, this is fat, subcutaneous tissue underneath the skin. So these are the skin edges, but they just like, stretched and separated. But this is where it was cut.
And is this that deeper injury that you mentioned just a moment ago?
Yes.
To the basically the top, maybe backish part of his left shoulder.
It entered the shoulder joint.
Okay. 170.
This one is a blurred photo of another sharp force injury on the left forearm.
The inside of the left forearm.
Yes.
And then this one also has a blurred area sort of in the groin area. Do you see that?
Yes.
Is that blurred out just for sensitivity's sake?
Yes.
Okay. 171.
And that's a close-up view. So you can see it's got another sharp edge and you've just got tissue that's coming out from the wound, but that's the cut edge right here.
Okay. And this is on the, what I would describe as inside of the left wrist, is that right?
Yes.
Or forearm area?
Yes.
172. What are we looking at in 172?
So this is the head and you're looking at the left side, the ears right here. So there's a cut right in the posterior or the back part of the ear on the scalp.
173.
And a close-up view, the cut.
Let's talk, since we're now seeing for the first time head injuries. Can you tell the jury, just so that we're all clear, do head injuries have a tendency to bleed heavier than other types of injuries that a human could sustain?
Yes, there's a lot of blood vessels in the scalp.
And does that cause more bloodletting, potentially staining of scenes where blood is coming out of a person?
Yes.
174.
So we're looking at the right side of the head and we're trying to show, this time it's a laceration. It's not caused by a sharp object. It's caused by a blunt object. So we call them lacerations because it's so hard to see because it's decomposed, but the edges are jagged and underneath the skin, you can still see what they call tissue bridging. That means it wasn't completely cut. Like with a knife, you can completely cut the skin and the subcutaneous tissue, but with blunt trauma, with a blunt object, you may still see some tissue that's not separated yet. So this is a laceration on the right temporal region.
So would this be basically right side of the head towards almost a little bit to the back of the head there?
Yes, the ear is right here, right ear, and then you can see that there's a wound here.
Okay. 175.
And here you can see the wound. I don't know if you can see it, but that's the wound right here. And you can see like the edges are not like a knife wound.
So these injuries, as you look at them as the expert in this, the edges are different to you from what we've seen before from the sharp force injuries.
Yes.
And then when we talk about a blunt force injury like this, what kind of things can cause a blunt force injury like these?
Any blunt object like a bat, piece of wood, hammer.
Could even the butt of a gun.
Yes.
176.
So this is another laceration that's on the top of the head.
And when you say laceration, are we again talking about another blunt force injury
Yes.
to the top of Gannon's head?
Yes, and then this is the skull, the bone right here, and there are no fractures.
Okay. 170, is it 77? 177?
So this is the one we were looking at previously, and then there were other two lacerations on the top of the head.
Again, just so that we're clear, when we say other two lacerations on the top of the head, are those other two also blunt force injuries?
Yes, and you can see that the edges are jagged. It's not like a clean cut. So that's why I called it laceration.
Okay. 178?
So when we peel the scalp, remember the laceration that was on the right temporal region behind the ear? These are skull fractures right here. And then some of the bone fell, and you can see some brain tissue, decomposed brain. So this is a fracture, 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 fracture.
When we talk about this area of the skull, you use the word temporal. Does that to layperson mean temple area basically, extending to the back area?
Yes.
Is that bone thinner than other parts of the skull on the head?
Yes, the temporal bone is, but it also involves the other bones.
And so what I'm driving at is, would it take a lot of force to cause these types of fractures through a blunt force strike?
Yes.
And just so we're clear, since we've moved past the sharp force injuries and now we've looked at all of the blunt force injuries in these photographs, how many sharp force injuries did Gannon suffer that you were able to document in your autopsy?
I counted 18.
And then as it relates to the number of blunt force injuries that Gannon suffered, how many did those occur?
4 lacerations.
4 lacerations that coincide with blunt force injury?
Yes.
Okay. If we can move on to 179. What are we looking at in 179?
So this is the left side of the face. Here's the ear, head, eye area. This is the jaw, the left side of the jaw, lower jaw. And there's a hole right here.
What caused that hole?
This is due to a gunshot wound.
180.
And this is a close-up gunshot wound.
Is it typical, doctor, when you document a gunshot to try to figure out path the bullet traveled as it entered into a human victim?
Yes.
Did you do that in this case?
Yes.
Can you describe, either using the diagrams or just through words, however you want to do it, can you describe the path that this particular bullet took through Gannon as it entered his body?
I think we should use...
Okay, I'll come over and help.
Oh, it's not easy.
Which one do you want? 46, 145? 145? Make it easier on our jury, we also got the shortest easel we could find. So I'm going to hold this up actually, doctor, if that's okay.
Go down.
That's okay. Well, they won't be able to see it.
Okay.
Like that.
So the entrance gunshot wound was in the left side of the jaw, lower jaw, the mandible. This entered the oral cavity. It hit the cervical, this second and third cervical vertebrae. So it went to the back. It crossed the midline, and I recovered the projectile. It didn't enter the skull, the cranial cavity, so I recovered it on the right side where the muscles are of the neck. So there was a projectile that went from left to right and then front to back.
And then, so when you recovered the projectile, was it still in the basically the muscle tissue in the back of the head?
Yes.
Okay. So, doctor, you can sit back down if you'd like. When we're talking about the types of injuries that Gannon, that you were able to identify as, that Gannon had suffered, 18 sharp force injuries, 4 blunt force lacerations, and then one gunshot through the chin. Does that indicate to you that there's some progression that these injuries had to occur in?
Yes.
Tell the jury what we mean by that and what it is that you're using to rely on and make that conclusion.
Regarding the sharp force injuries coming first,
Well, do you know which one came first?
I don't really know, but I'm thinking that it's the sharp force injuries because he could still defend himself. And then I don't know which one came first, the gunshot wound or the blunt trauma to the head, which caused fractures of his skull and bleeding in his brain.
So the best that you can tell is that sharp force injuries occurred before gunshot. Is that right?
Yes.
But it's unclear whether blunt force or gunshot, which one of those occurred first.
Yes.
Does that indicate some period of time to achieve all of those injuries for whoever was attacking him?
Yes.
The fact that there's 18 sharp force injuries
Yes.
and then 4 blunt force injuries
Yes.
and then a gunshot that entered into the lower left chin and traveled through the oral cavity and all that?
Yes.
What were you able to rule as the cause and manner of death for Gannon Stauch?
My cause of death was gunshot wound and blunt head trauma of the head.
Were there contributing factors to the cause of death?
Yes. Sharp force injuries.
Those 18 sharp force injuries that we talked about?
Yes.
And what was the manner of death?
Homicide.
Is it typical, doctor, that you perform a toxicology test as well
Yes.
when you do an autopsy?
Yes.
What is the purpose of doing a toxicology report?
We do it in all violent deaths, and it's to determine whether there were any drugs or what drugs were in the system.
Was that performed on Gannon Stauch?
Yes.
Was there anything unusual detected in Gannon Stauch at the time of autopsy?
There were some drugs, or there was a drug that was present.
Okay, so let's talk first. Acetaminophen, a typical over-the-counter medication, was that found in Gannon?
Yes.
Would that be anything unusual that a child would have potentially residual acetaminophen at the time of autopsy?
If maybe the decedent at that time was having a fever or pain, they would give them acetaminophen or Tylenol.
Would that be common, though, in an 11-year-old to find that in a body potentially?
Not, you don't always see that.
Okay. What other things did you find in Gannon's bodily tissues?
He also had hydrocodone in the liver tissue.
All right, so let's talk about hydrocodone. What is hydrocodone?
Hydrocodone is a narcotic analgesic. It's a drug used for pain, and that is also found in cough medications because it's supposed to suppress your cough.
Is hydrocodone a controlled substance?
Yes, you need a prescription for that.
So I can't just go to Walgreens without a prescription and buy hydrocodone?
Yes.
Is it indicated as highly addictive?
Yes, you can be dependent on it.
What are the effects of hydrocodone on a human?
Depending on the dosage, you can initially become drowsy, lightheaded, dizziness, and if you take a higher dose, it could lead to respiratory depression, or you'll have problems breathing. You'll have lethargy, coma, and eventually death.
Was it unusual, in your opinion, to find hydrocodone in a child of 11 years old, like we did here in Gannon's death?
Yes, I found it unusual.
Is that because of all of those issues you just described?
Yes, and if it was for a cough, you would give something that didn't have the, narcotic analgesic in it.
Typically, people would not.
Yes, that wouldn't be the first line of choice.
Okay. May I have just a moment, Your Honor?
May.